So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARS. Okay, because Simply Nature PPARS protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system, the integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So those are some of the benefits. So actually combining Simply Nature PPARS and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
Hi everyone, welcome to another episode of Simply Healed. We're so glad that you're joining us again on our regular slot on Thursday, the longest running cancer discussion forum program online right now. Yep. So Doc Jansen, good to see you again.
Yeah, hello Sean, hello everyone, glad to be here again. Tonight, we're going to be discussing all about cervical cancer. Okay? So for cervical cancer, it's the second leading cause of cancer among women here in the Philippines. Cervical cancer is actually estimated to occur in about 7,800 women every year. And these are new cases, okay?
Wow.
And then also, in terms of cervical cancer deaths, it's estimated to be around 3,800 every year, okay? So this is actually a very common cancer among women.
But it's also a very treatable cancer if you detect it
early. It's very treatable if you detect it early, but the mortality rate is also high if it becomes advanced already. Okay.
So Doc, what is cervical cancer? Maybe a simple biology lesson for all of us.
Okay. So just to be clear, where the cervix is. Okay. So this is the female reproductive organ. So the cervix is found here. Okay. So it is actually at the collar of the uterus. Okay. So this is what cervix looks like. So on the left is the normal cervix. So as you can see, the cervix is actually round in shape. It's like a donut, no? So it's like a donut. Then at the center, that is the opening. If you go inside that, that's going to be entering the uterus already. Okay, so that is what the cervix looks like. Now, this is the normal one. Now, this can change in appearance when a woman gets pregnant. Okay, but if a woman gets cancer, this is what it will look like. Okay, on the right. So here on the right, you can see a fungating mass. Okay, a fungating tumor. You cannot actually see the cervix already. It's already very different. Okay, so
is it painful?
Usually yes, but the pain is not that. It's not excruciating.
Not like bone cancer.
Yeah, it's not like bone cancer. There is just a discomfort that you can feel, which one of the symptoms.
So that makes it even more dangerous because looking at the picture, it's not a good condition, but you don't really feel
anything. By the time that you feel symptoms with cervical cancer, usually it will already be in an advanced stage. Okay, so here are the symptoms. All right, so as you can see in the previous picture, you have bleeding. Okay, the cervix is actually bleeding, so you will have spottings, intermenstrual bleeding or bleeding in between your menstruation. You can also bleed more heavily when you are on your period. Okay, you can have an increased vaginal discharge, which has a fishy or a foul odor. Okay, for cervical cancer, there is a very distinct smell that when you smell that odor, it is almost always cervical cancer.
Wow.
Yeah, so next is unexplained persistent or pelvic or back pain, okay, especially in the lower back. You can also feel that, and pain during intercourse. Tension.
What should they do next if they have this like persistent pelvic back pain and then pain during intercourse? What's the thing that they should do?
Okay, you should go to your doctor immediately. Okay, especially to your OBs. So when you go to your OBs for a consult, explain the symptoms. Now, these symptoms, usually to diagnose or to suspect cervical cancer, it should be a combination of these symptoms. for the risk factors, what risk factors increases your chance to develop cervical cancer? So we know that the most common cause of cervical cancer is HPV infection.
Which can be vaccinated.
Yeah, you can get vaccinated for this. So watch our previous video to know to know about this. Okay, HPV infection. You have different types of viruses of HPV. You have the low risk and the high risk. It's the high risk HPV viruses that you should get vaccinated for, and this is the most common reason why you develop cervical cancer. Now, what are the risk factors? HPV or human papilloma virus is transmitted mainly through sexual activity. Okay? So if you have multiple sexual partners, if you are smoking, why? Smoking because it's just because smoking decreases your immune system, okay? It weakens your immune system, so that's why. Okay? Next is exposure to miscarriage prevention drug called diethylstilbestrol. Now this drug is mainly used way back in the 1950s. It's not used anymore now because it is cancerous. Okay, so
shouldn't be prescribed right now.
Yeah, shouldn't be. Okay, you should not be actually taking this. Okay, but for our grandparents and to some extent our parents who lived through the 1940s, 50s. Okay, they might have had the exposure to this. Okay, so you have to be very, very wary about that.
But perhaps let's just go through screening and diagnostics.
So,
how would they go about screening and diagnosis?
Okay, so how do you screen for cervical cancer? If you want early detection, it's pap smear. Pap smear can be done once every 3 years for sexually active women or who have had a sexual encounter before.
Doc, you mentioned once every 3 years. So, important question right now is, how fast is cervical cancer? I mean, will it grow very rapidly? That if you are just unlucky that you're in between.
Okay.
So how fast is cervical cancer?
No, usually cervical cancer takes years to develop. Okay, so it's also a slow-growing cancer early on. But if nothing is done, it becomes in an advanced stage, then it can grow very fast.
So pap smear is a good strategy.
It's a good strategy.
Ladies, don't miss your pap smear testing, especially if you have all those
risk
common
factors.
Risk factors.
Okay, so you know yourself. Okay, so another confirmatory test is HPV DNA test, which detects the HPV virus itself. Okay, which detects the high risk virus for developing cervical cancer. So that is also one of the screenings that you can do. All right, next is biopsy. Biopsy is a confirmatory test. Then imaging studies that you can do is transvaginal sonography. So this can be used as a screening or staging. But when it comes to staging, we have limited information. So because you cannot see the lymph nodes with ultrasound, and you need to see the lymph nodes to properly stage cervical cancer. So next is abdominal or pelvic CT scan, which is the one that is used to stage cervical cancer properly. Okay. Now let's go to the staging. So we have 4 stages. All right. So the first stage is when the tumor is still confined in the cervix.
Wow.
Stage 2, when it invades the uterus. Then stage 3 is when the tumor invades the pelvic wall, lower third of the vagina, if it already involved the lymph nodes, and if you already have a non-functioning kidney. Okay. So lastly, stage 4 is when you have metastasis to the distant organs already, like your bladder, when I say bladder, your urinary bladder, your rectum, the distant lymph nodes, the more distant ones, like your neck lymph nodes, okay, shoulder lymph nodes, your lungs, your liver, your bone.
So what I saw that was interesting or important to note is that you mentioned that if you have cervical cancer, then kidney functions
can
get damaged.
Yeah.
Then can that actually lead to kidney failure while you are fighting cervical cancer?
Yeah, it can lead to kidney failure, especially if you cannot void normally already, and the pressure just builds up. Okay, so it can also happen.
No, I can also imagine. Wouldn't this have a lot of other complications because you have toxins building up in your body?
Yeah.
You can't wee and I'm sure many other organs get.
Yes, exactly. Especially if both kidneys are affected, then you will have to go on dialysis.
Doc, what about treatment? How does a person treat cervical cancer?
Primarily, on the early stages, cervical cancer can be treated using surgery, and it's really very, it's quite easy to do. as well, because you just remove the uterus together, of course, with the cervix. You remove the ovaries, so actually it's you remove everything, no, the whole female reproductive organ. Then the prognosis of patients with this procedure is really good. Okay, because after the surgery, you just have to go on a brachytherapy. Then that's it. Okay, quite simple. But if the cancer already becomes more advanced, then surgery might not be an option already.
Because it's in more than one location.
Yeah, it's in more than one location, so it's actually not going to be wise already to do surgery, because even if you remove the tumor there, you have other locations that needs to be treated. Okay, so what we do is to go for a concurrent chemo and radiation therapy. So now, why should it be together? By the term concurrent, chemotherapy and radiation therapy should be administered together. Why is that so? So because for cervix, no, for the cervix is not, it's an organ where the cells do not replicate that fast anymore. Okay, so if it's that way, then it won't be as sensitive to radiation. That's why you need something that will stimulate the replication of cells, which is chemotherapy. Okay, so you administer them together so that the radiation therapy will be effective. So now, what is that chemotherapy that is usually given to cervical cancer patients for this purpose? It's cisplatin.
Which is very important.
Yeah.
Later,
okay?
Mention why.
Yeah,
Wow.
so cisplatin, as all of you know, it's both cytotoxic, and in this case, by the term cytotoxic, it directly kills cells. It directly kills the cancer cells, both the cancer cell and the healthy cells, okay? But you need this because cisplatin also functions as a radiosensitizer. So a radiosensitizer means it's something to make the radiation more effective. Okay? So it's given together. All right?
What are side effects to watch out for?
Side effects,
when you're going through
yeah,
this chemo?
because this is quite toxic. You can just imagine you just undergoing radiation therapy, and then it's both at the same time, right?
Wow,
so, side effects to watch out for: anemia, fatigue, decreased WBC count, so you'd be more prone to infections.
Which, if you have a damaged kidney,
Yeah, all
it's
the
just
more
gonna increase all the risk.
Yeah, all the more bad news, no?
Yeah.
Nausea, vomiting because of the cisplatin, dermatitis, dryness of skin because of the radiation, bruising, bleeding because of decreased platelet count, and then UTI. Okay, so those are the side effects that you have to watch out for. Now, why is this so? Especially for anemia, fatigue, decreased WBC count, and the bruising and the bleeding. Okay, why do we have these symptoms? It's because cisplatin it's actually toxic to the bone marrow. Okay,
Wow.
it's
yes.
these white blood cells, no, your white blood cells, your red blood cells, your platelets, all grow from the bone marrow. Now, if you damage the bone marrow, then naturally your WBC, red blood cells, and your platelet counts will go down. So there is actually a way for us to minimize the toxicity inside the bone marrow, which is actually what I usually prescribe to patients, which is Simply Nature PPARS. Okay, because Simply Nature PPARS protects the integrity of the bone marrow. So even if you receive this, the radiation, the chemotherapy, yes, you will feel the side effects. You will still feel nauseous. You can still feel vomiting. You can still have vomiting. You can still lose your hair. But yeah, you won't have as much anemia. You won't have your immune system, the integrity of your immune system will be preserved. And of course, you won't bleed out because your platelet counts will still be there. Okay? So, those are some of the benefits. So, actually, combining Simply Nature PPARS and with this treatment actually makes it more easy for patients to finish the chemo, the radiation.
And we do know that the chemo radiation therapy, though difficult to endure, does work to treat and cure you of cancer. So together with the extract, Simply liquid extract, to work together to minimize all the damage.
Yeah.
This is just good news and good news and good news for all cervical cancer patients. And of course, for those of our viewers who are always very interested in natural, yes, have a consult with Doc Jansen because Simply Nature protocols work very well in lifestyle medicine to provide you a natural approach to treating cancer. But we always talk about chemotherapy and radiation therapy because when cancer reaches the third and especially the fourth stage, time is of an essence. You don't want to stand on a ideological perspective. You don't want to stand that I am natural, I am what? No. I think when you're at fourth stage, you want to say, let me use everything that works. Right?
Use everything that works to increase the quality of life, to extend your lifespan. Okay, because time is more important now than ever.
Yeah, so once that's why for me and Dr. Jansen, we believe in natural too. I mean, that's why Dr. Jansen's a lifestyle medicine doctor, right? Using foods to heal. But we do take time to talk always about chemotherapy and radiation therapy because many of our viewers are afraid of them. But please don't misunderstand. Dr. Jansen is vegan, right? He takes purely only vegetables. So of course we are firm believers of the natural approach, but we have to, for your good, for the good of our listeners, we have to help you not be afraid, so that if you really are in late stage cancer, you will use all the best options available to you. All right, so that's why we talk about chemotherapy and radiation therapy so often. So Doc, if we move fast, what is the success rate? And why for late stage cancer we would go to, use such strong therapy like chemotherapy and radiation therapy? What is the survival rates of cervical cancer?
The numbers that you see here, please try to understand how they came up with these numbers. So these numbers are the ones, are the chances, the survival rates in 5 years. So if you first got diagnosed with an early stage or localized cervical cancer, then your survival rate is 92%. Why is it like so? It's because at an early stage, of course, if you know that you have cervical cancer at an early stage, you get treated. Okay? How do they treat early stage cervical cancer? If it's so small, then just a simple biopsy will do.
Wow.
Okay.
And then eat well, lifestyle medicine, and make sure you recover.
You survive. Okay. If it is a little bit big already, then do the surgery. Once you're done with the surgery, usually oncos are a little more. In Filipino, we call it sigurista. More thorough. They don't want to take chances. They want a more aggressive approach, so they give you radiation therapy. That's why you have a very high survival rate, okay, for a localized cervical cancer. But when it goes regional, right, once it involves the other organs, when surgery is already not an option, then it decreases to 58%, okay? Especially if you got diagnosed with stage 3, stage 2, stage 3, cervical cancer, then this is what happens, especially stage 3. Now, for distant cervical cancer, metastatic already, then chances is 18% of survival. Okay, so as you all see, for all cancers, the more advanced it is, when you get diagnosed first, then the prognosis is bad. It will be worse. Okay, so it's very important. Time is of the essence. Try to take action immediately. Okay, do not dilly-dally and try to go doctor hopping. Okay, if you see a good doctor that knows what he's doing, then go for it.
And right? As we talk about time being the essence, we also notice that the questions are coming in. I can see some questions are focused on cervical cancer, but there are also other questions coming in general about other types of cancer. And of course, I see a few questions coming in about what foods to take, Doc. So without further ado, let's move to our AMA Ask Me Anything segment.